I'm going to talk to you about an interesting remedy today that I've been trying to study for a few days, and maybe we can share a little bit about it. So we are talking about the remedy Bambusa. As you know, it belongs to the Gramineae family, that is the grass family. It's an interesting remedy. Interesting remedy also because you should know that this is a remedy which has been used for the longest time in folk medicine, especially in typically for tuberculosis, for asthma. It has a lot of anti-inflammatory, anti-tumorous effect, and the root has been used for a very long time for digestion, for ringworm, and earache and things like that. But typically, clinically, there are a few things I want to tell you where this is a very, very important remedy. The main thing is rheumatism and arthritis, and especially action on the spinal cord, typically the back. And that's why it kind of rivals Calcarea floricum. I'm going to compare Bambusa, Calcarea floricum, and Rus toxicodendron. And I believe that these three come very close to each other. And that's where I believe that many cases where we are giving Calcarea flor or Rus toxicodendron, maybe could be Bambusa. So my idea to think of more creative kind of innovative kind of ways to prescribe is the reason I'm making this video. So maybe some of us can prescribe this remedy more often and collect some data as a collective knowledge to help more patients. Let's see. So I told you a lot of action on back pain and sciatica, like Rustox aggravated by damp cold weather, a lot of numbness, radiating kind of situation, radiating pains. It's also very important hormonal remedy. That's what the writers have written, typically for postpartum depression. It's a very important hormonal remedy. What is the main thing that I want to tell you about its mind state, which is very interesting. One of the very interesting kind of phenomena is this anxiety about future. Anxiety about future, dealing with future happening. Proving has been done by Schuster, and we'll go there very soon. But look at this very interesting symptom here. This is what almost reminds you of Calflow. Let's go ahead. Here you see cares full of about financial matters. Again, it comes close to floricum. Change desire for, fluorine wants change, but maybe there's a more sexuality element in fluorine and in Calcarea flor, not so much in Bambusa. Have a look at this. Company aversion to with quarrelsomeness. Again, Calcarea Kali. A lot of sensitivity and a lot of stress. You can see this stressed mentally and emotionally. This seems to be a very strong symptom here. Stressed mentally and emotionally. The other very, very strong symptom that you will find in this remedy, which is very interesting also, which I found. A lot of helplessness. And that's where you will see a lot of insecurity. Typically, the writer has written a lot about this being a more important remedy for women than men. And that's why some of the proving symptoms are handle things cannot, overwhelmed by stress in women. A lot of forsaken feeling with beeping. Here you can think about very close to remedy like lithium. Despair, support, desire. Now, this is where a very interesting terminology comes up for the remedy Bambusa. Despair, desire for support. There's a lot of desire for support, and that's where, when a patient tells you, I want support, I feel insecure, we straight away go towards Calflow. This is a very interesting differential diagnosis for you to think about. Have a look at the other symptom. Despair of death with fear that will separate him from his children. Death will separate him from his children. So fear of separation. Everything is insecure. Delusion, everything is insecure. Delusion, he is poor. Delusion, he is deceived, cheated. Very, very interesting to think about this remedy. Let's see what Schuster writes. And a lot of proving material has been done by Schuster. Also written here, you can see bamboo spine, which is one of the things that happens in ankylosing spondylitis, chronic spondyloarthritis, in some form of cancer, in brittle bone disease. Almost reminds one of this remedy. That's what she writes. And there's a relationship between ankylosing spondylitis and autoimmune diseases like Crohn's, neuralgia, iridocyclitis, uveitis, and that makes this remedy, Bambusa, an interesting remedy in these cases. One of the main keynote is written by Schuster. The feeling of being caught in life situation without having possibility to cope up. And there's a feeling of lack of support. It's very important. Lack of support and feeling of trapped. Bamboo has a strong influence on spinal complaints and hormonal disorder. And that's why there is an expectation that this could become a very important woman's remedy. And the bamboo shoot itself is a plant embryo and gives a lot of signature, like a, that suggests that this could be a very important remedy post pregnancy, post delivery, and the time after. That's why it compares with sepia in postpartum kind of delivery, depression kind of state. Lot of symptoms of rheumatism actually in this case, this remedy. Although very chilly, better by hot. Again, you think what restores. Probably one of the few differentiation is that generally exercise aggravates is an important symptom for Bambusa, which is an opposite to calflor and rustop. So that's the other thing. A lot of desire for cheese and chocolate that you want to think about. A lot of hormonal symptoms, heat flushes with sweat, reminds you of a lot of hormonal state. And the desire for support and leaning against something is something that you will see in this remedy again and again. So this is a little bit about a little clinical idea about this remedy. I hope that we are able to kind of go through a few writings from different literature. In the complete repertory, you will see many symptoms of Bambusa. So I was always very curious to know its drug picture, and I think that we are able to formulate a drug picture which can help us to prescribe more often. So write to us what you think about it, and thank you so much.